Good afternoon. My name is Denis Desautels, and I'm the acting chairperson of Canada's International Development Research Centre. Bon après-midi à tous. Je m'appelle Denis Desautels.
Good afternoon. My name is Denis Desautels. I am the acting chair of the International Development Research Centre. It is a Canadian Crown corporation, as you know.
I welcome you this afternoon to our 5th annual public meeting. This is a relatively new requirement for federal Crown corporations and one which I fully support. We're delighted to have this opportunity to tell Canadians about our work. Joining me this afternoon on stage are Jean Lebel, President of IDRC. Next to Jean is Federico Burone, IDRC's Regional Director for the Latin America and Caribbean region. He is based in Montevideo. And Trent Ho, IDRC's Corporate Secretary, the person who always keeps me on the right path. First, I would like to mention that simultaneous interpretation is available in French and in English, and headsets can be picked up at the back of the room. And please note that this meeting is being videotaped and will be available on our website. A DVD on IDRC and the 2013 annual report are available at the back of the room as well for those who may be interested. I'm honored to be presiding this meeting today, which I'm sorry to say will be my last as an IDRC board member. I joined the board in 2006, and my second 4-year term will end on January 2nd, 2014. It's been a real privilege to serve on the IDRC board along so many talented and thoughtful people. These have included internationally respected development experts and former cabinet ministers, and all through my 8 years as governor, I've been impressed by the expertise of my fellow governors and inspired by their enthusiasm for IDRC's mandate. Whenever they spoke, I always listened very carefully. A number of governors are here with us today. I would ask my fellow governors who are here to please stand and be recognized. Sarah Fountain-Smith, Gordon Hulden, the Honorable Monty Solberg, and Cindy Turmor-Sushin. Okay, I practiced, but I didn't quite make it. Thank you to all of you for being here today. Depuis plus de 40 ans déjà.
Over the last 40 years already, IDRC supports researchers in developing countries to resolve development problems. Those researchers believe that those problems are crucial. IDRC is an integral part of the foreign affairs of the Government of Canada. These programs contribute to the priorities of Canada with respect to international development in sectors such as maternal health, child health, and food safety. By funding research that improves the conditions in developing countries, IDRC contributes to prosperity and world safety. During the last decade, I had the privilege to be part of the board of directors of other Canadian organizations. IDRC is very special in my heart, probably because it is a very special organization. IDRC is part of the largest funders with respect to development in the world. Compared to other funders, IDRC creates new possibilities for research.
IDRC really engages with its grantees throughout the research process as a research partner and advisor. This is what we call our Grants Plus business model, which has, we think, greatly contributed to IDRC's success. In fact, we recently commissioned a survey to find out how the center is perceived by the researchers that we fund. Grantees pointed in particular to the center's knowledgeable, professional, and engaged staff as a key strength. Indeed, a major factor in IDRC's success is the caliber of our people. The center employs highly qualified experts and scholars, but it is no ivory tower. IDRC tries to be as realistic and as practical as is possible in the research field and does not fund research that will gather dust on a shelf. We support results-oriented research that has real impacts on the ground in improving public policies and people's lives. The highly qualified people who work at IDRC put their talent to use for the greater good. They share a common goal with the researchers that they work with to find low-cost, down-to-earth solutions to complex problems in so-called developing countries. Let me give you a few examples. IDRC-funded research is helping to secure a better future for children and youth across the developing world. In Canada, 16% of the population is under 15 years old. By contrast, young people make up 41% of the population in the least developed countries. Meeting the needs of this new generation is a Canadian aid priority. IDRC contributes to this effort in a number of ways. For example, youth unemployment in Africa threatens to undermine gains made in reducing poverty over the last 30 years. IDRC-funded researchers are finding ways to expand job opportunities for young people. Another
inspiring alternative helps talented young Africans to realize their potential in mathematics, which is really the backbone of modern economy. The Ames Research Center will launch its fifth Excellency Center. Up to now, 560 young scientists had their diploma from Ames, and most of them stayed in Africa to tackle the problems that their continent is facing. IDRC administers Canada's part, that is an amount of $20 million. Canada's commitment attracted other funders, and as an example, the Department for International Development of the UK went in the same direction and gave $29 million and asked IDRC to manage this money. We also want to make sure that these funds will help to mobilize the support from this private sector. His Excellency, the Very Honorable David Johnston, is promoting Ames, and during his speech during a reception organized in Ottawa recently to underline the 10th anniversary of the initiative, he said that it is fantastic that Canada is participating in this effort thanks to the leadership of IDRC. He gave the marvelous example of the diplomacy of knowledge, which brings people, institutions, and nations to work together beyond borders and disciplines to enrich our knowledge and to improve human condition. The Governor General's speech expresses IDRC's mission, meaning enriching knowledge and to improve human condition. His speech also describes the fundamental objectives of the 860 research activities of the staff centers that the staff center has launched.
Center's operations. IDRC presently employs about 400 people. In Ottawa and at 4 regional offices, which are in Cairo, Montevideo, New Delhi, and Nairobi. In the last fiscal year, IDRC staff administered a budget of almost $202 million. About $158 million of this came from Parliament. that is, from Canadian taxpayers. This amount represents about 3% of Canada's aid budget, and we used it to help leverage a further $42 million from other donors. One of my responsibilities when I was Auditor General of Canada from 1991 to 2001 was to examine the financial performance of the government and its crown corporations and agencies. And so, even before I joined the IDRC board, I was familiar with the center's sound financial management. I knew IDRC was a well-run crown corporation and a careful manager of Canadian tax dollars. Since joining the board, one of my roles has been to chair the Finance and Audit Committee. In that capacity, I hope that I've helped to ensure that already good systems at IDRC are now even better. So I'm delighted now to introduce IDRC's president, Jean Lebel. Jean joined the center 16 years ago. He is an agriculture and food security specialist who has helped to build IDRC's strong reputation in this area. Pendant de nombreuses années, Jean...
For many years, Jean led the program entitled Agriculture and Environment, and under his leadership, IDRC supported one of the best scientists in the world when they were looking for better ways to have nutritional crops. Before becoming a president of the center, Jean was vice president, and he took care of all the programming of IDRC research. He started new partnerships with Canadian funders and international funders. What always impressed the board is the way he invested himself in his role and how fast he was able to meet the challenges. And I would like to invite Jean to speak to you further about the impact of IDRC in the whole world. Jean. Let's breathe.
Bon début de soirée, tout le monde.
Good evening to all of you. Thank you for your participation. Thank you, Denis, for your kind words. And thank you to the Board of Directors for your support and for all the members who are here.
As well as representative of the Diplomatic Corps of Ottawa, in particular the Ambassador of Uruguay, where we have an office, His Excellency Elio Rossellini. Welcome and thanks for joining us. Je suis ravi de vous voir ici aujourd'hui.
I'm very happy to see you today. And I would like to talk to you about what we are accomplishing over the last 40 years. And I would like to talk to you about my experience and the reasons why we are accomplishing this type of work.
IDRC to support research for international development, as many of you know. And this creates value in three important ways from my perspective. Alors, par l'entremise du CRDI,
through IDRC, Canada wants to support international development, and that creates value in three different ways, three important ways.
We build self-reliance and local problem solving in the developing world. This decreases, over time, the need for international assistance from Canada and others. Second, we contribute to global trade, economic prosperity, and stability. This makes a difference, not only to the community that we're working around the world, but also with the life of Canadian, and I'll bring you some example of this. Third, our support for research is relatively small in the grand scheme of things. But still, in our view and in my personal view, it's extremely effective use of those resources. It creates new ideas. I'm not here. It put them to the test. and it sets the stage to take good idea further. I will cover each of these 3 points in my presentation this afternoon. And I will start by letting you know how we build self-reliance, and I will start with my own experience as a researcher, young researcher. Put yourself almost 20 years ago. Take 30 pounds of my weight, a bit more hair, and my own experience as I work in the Brazilian Amazon with a small grant of IDRC initially of $15,000, $15,000, for a team that wanted to investigate a problem that at that time was making the end news, mercury poisoning in the Amazon. And that was a work that was conducted in a team with young student. I was part of the young student at that time, Canadian student as well as Brazilian student. And why did we go to the Brazilian Amazon and village along some river stream? Because there was a demand put to us by a colleague in Brazil that was working on the issue and scratching his head on how to resolve the problem. You may be familiar with an old technique that has been used for ages to separate gold from the matter it's linked to. It's to use mercury. Mercury and gold likes each other. In the Middle Ages, they were amalgamating, the alchemists, gold. Gold was melting literally in mercury, which is liquid at room temperature. And after that, they were burning the amalgamate and recuperating the clean gold without any dirt. This technique persists. It's called artisanal gold mining. It's still present. In the 80s and beginning of 90s, there was a boom in the Amazon. 1 million persons were exercising this type of activity in very precarious, situation. They were called the garimpeiros. And everyone knew they were using mercury in their sluice box and retort, which are tools that they're using. And everyone knew that the mercury was going into the environment. And everyone was saying, this is dangerous. This is dangerous because in Japan, we had one incident in Minamata Bay where, through a chemical process, mercury was leaked into the Minamata Bay, got into the shellfish, people were consuming it, and then we're getting ill. 2 forms of toxicity. First, baby in the mothers were exposed in utero. And mothers start to give stillbirth, people with missing limb, babies with missing limb, what is called in science teratogenic. That was one effect, dramatic. The second, it was affecting adult, visual field, motor function, people, shaking, getting intoxicated. And what the research showed at that time is that the mercury that was getting into the water was transformed into even more toxic material that was getting into the fishes, and the fishes were consumed and the people were getting intoxicated. And that raised a red flag. But in the Amazon, we were not seeing this. In the Amazon, mercury was used by the miners. Everyone was pointing to the miners saying, there's a problem there. So we went there. And we start to measure mercury in the environment, in the water, in the soil, in the fishes. What did we discover? Yes, mining was important, very locally. But in the entire watershed, it was the soil that had mercury. Ancient soil that has accumulated mercury from the vapor of the volcanoes or from industrial processes. Slash and burn activities, runoff of soil into the water system, mercury going into the water, temperature, pH, everything was there, getting into fishes, and fishes, mainstay for the population in terms of consumption. Once people were eating that fish, we were not seeing any effects. And we were scratching our heads because the level in the environment were quite important. We figured out that it was not only mining, it was the watershed. We figured out that fish was the source. And then we start to look at indicator in human, and we discover that there was alteration of the visual function and the motor function at very low level that were not detectable clinically, like when you go to the doctor and you got an exam. But with a very sensitive test battery, we could measure changes in the nervous system that were negative. And that could be predictive of greater problem. What do you do there? You have identified a problem. It's not the one that you thought. You have seen that there's effect. Now, how do you cut the exposure? We work with women groups. We develop poster, very simple, with red fish, highly contaminated, yellow fishes, mildly contaminated, and green fish. I won't give you the detail why the color coding is about the food chain. After 4 years, through a very simple design of a program that was linking public health with environment interests, we had a reduction of 40% of exposure in women of these villages. Why? Because, there was a program that was put together in these communities saying, if you are eating a red fish at one meal, why don't you go for the next days on a yellow or even better on a green fish? And simply changing the dietary habits and shifting consumption on different type of fish in an environment where we had sampled, 48 different species in a radius of 1 kilometer, so diversity was there, reduces the exposure, reduces also the neurobehavioral outcomes. But that was not enough, because the source was slash and burn. So the research team there started to look at buffering zone on the river margin in order to prevent the release of mercury. Look at nutrition with other type of food like nuts that seems to be preventing the exposure. So the long story short over here is that it took us about 4 years to put this all together. Everyone was saying that we were crazy because we were doing this in the jungle, and it was not what it's supposed to be. What it was supposed to be mining is the problem. Mining was only one very small fraction of the problem. And still today, there's a research team that is pursuing this work. In fact, there's many. And what gives me pride and self-reliance over here? My field aide was named Carlos José Souza Passos. He was a first-year student in biology at the University of Federal of Para in Santarém, in the middle of the jungle. He helped me to cut fishes, to cut, carats of dirt, to take hair sample, to do all the analysis. He got a kick at it. He came to Montreal, did his master, learned French, learned English, did his PhD, went back, and he's a full-time tenure professor at the University of Brasilia. And with a few other colleagues that came afterwards, from the origin of this project, graduated, went back, they are pursuing the journey. This is building self-reliance at a small scale. But they are doing the work now to solve the problem. And Federico, you were with me when we met one of these young researchers. So that's one example. The second example on self-reliance, Denis has already touched on it. The African Initiative of Mathematical Sciences. I will not repeat what he has said. I'm going to tell you that, last week when the young student came over here, you can look at the web, they made a compelling case of why we should put our resources there. One young student there, his first name is Martial, he will hate that I name him, gave us the story that he was literally coming out of the bushes, not speaking English, went to South Africa after a first degree in mathematics, did this hands-on training, problem-solving training at Ames, graduated, went to Cambridge, and he was not even done with his PhD in Cambridge, that, people were beating themselves around the world to have him as part of their, professor. He's now at Yale. He's an epidemiologist at Yale. He succeeded. Now, some of you will say, well, this is contributing to brain drain. No. 75%, I think, of the students that have graduated, of the 560, are finding work in Africa. They are constituting the backbone of, scientific expertise in engineering and mathematical and physics that is often required for things like, kilometer square array telescope. A telescope that is built by South Africa, but where Canada is contributing, making it the largest in the world, and, serving public interest as well as the buildup of knowledge. Alors, Je vous donne cet exemple-là de Ames parce que c'est un exemple qui me touche par...
I give you that example of Ames because that's one example that really touches me. Last spring I was with the Governor General on a state visit to Africa, and when I visited South Africa, I met young researchers at the Ames Center, and one of these young researchers, a young woman from Madagascar, was working on her graduation thesis. She was very generously, she was willing to receive us in spite of being very busy with her doctoral thesis. And I looked at what she was doing. I did my doctoral thesis on the brain, and I saw an image of the brain. I said, "What are you working on?" She said, "I want to understand what is happening in the zone of the brain where vision takes place." I said, "Yeah, but you're a mathematician." She said, "Yes, but when we do a scan, there's noise. The image is not perfect. And with filters that are used for mathematical equations, we can reduce the sound and get a very clear image." So I looked at her, and I was with a member of Parliament, for the MP for Waterloo, and he looked at me and he said, "Do you understand what she's saying?" And I said, "Yes, I understand what she's saying. She's a scientist and she's talking science." And I said, "This is wonderful. This is a scientist from Madagascar speaking to a scientist from Canada who speak the same language." That's what AIM creates. A capacity to have the highest possible level of expertise throughout the world. And this is why this is the next Einstein initiative. This is the next Einstein may come out of Africa.
Now that I've lost my pages, my apologies, I'm going to tell you to my second point, which is about the economic growth and the stability. Creating the enabling environment for local problem solving leads to this point about economic progress, stability, and improved health. And all this makes a change and a difference in the life of Canadians. Go to a farm. Look at the cattle that are there. They are important. Milk, meat, we know this. But these animals can also be sick. And a way to prevent the sickness is to develop vaccine. Canada has a worldwide expertise in vaccine development for, animals. Why is this important? You remember SARS? $160 billion, the economic cost that is estimated that this cost to the world. Where was it coming? From an animal. Did it get transmitted to human? Yes, it did. Did it affect our economy in Toronto? Definitively. The town was shut down. What do we do? Currently, we are working with one of the best researchers in that field, that is Dr. Lauren Babiak, who is the recipient of the Killian Prize, the best prize for science in Canada, the Gardner Awards in 2012 for public health. He is the Vice President of Research at the University of Alberta. He started working with South African Agricultural Research Center. And they are looking at the disease that is called the pest of the small ruminant. It affects, sheep, capri, small animals. These small animals are often the bank account of the poor. They have an animal that they grow, they feed, they can sell, make money, pay for health services, send their children to school. It's important. But the pest of small ruminant kills hundreds of thousands of animals when it comes up. They are developing a vaccine. This vaccine exists over here. Animals get vaccinated for this over here. But what's the challenge in a country in Africa under tropical condition is that they cannot keep the vaccine alive. They need a cold chain. And there's no cold chain. So they have been working on a heat-resistant vaccine. And the early signals that we get from the research that it's working well. Not only is it working well, but it's working well at a low cost. And not only is it working well at a low cost, but it's working well at a low cost where it can get produced here or there. This is contributing to a world that is prosperous, because you are preventing the spread of a disease, you are maintaining asset of people, and you are building, some good business. I could tell you other area like, violence. Cities as places where we are conducting live experiment to see what type of intervention works or do not work in order to prevent violence. Violence affects people. If you cannot go to work, that's not productive. If you feel insecure because, not the shooting in the street, but because, there's only one toilet, there's no doors, and you're a woman, and every time you get to the toilet, you're harassed, that's a difficulty. So what do we do? What type of intervention do we do, can we do, that makes it, safer, and that provide a better life and livelihood for these people? That's currently a big journey that we are doing with our colleagues from the Department for International Development in the UK and a team here at IDRC. We'll see the result of this. Research is a journey that takes time, but where you need to be always à l'affût, looking for new ideas. My third point, it's about the value of research. It's a great investment. By putting in relatively modest amount, as I was saying, we can make use of the Canadian resources, the Canadian taxpayer resources, to develop innovative ideas, test them, and set the stage for those ideas to be taken further with other partners. Another example, a few years ago with the Canadian International Development Agency, CIDA, Department for Foreign Affairs, Trade and Development now. We sponsor research in Egypt about small and medium enterprise development. One of the findings of the research was that for starting a small enterprise in Egypt, it was taking 16 different stops and 16 different offices with 16 sets of signature. Many of the people that are looking for the creation of a small and micro enterprise are women. Now, they are also often the ones that are carrying the family duty. So you can imagine, going around town in Cairo, shopping at 16 different places before you get the permit in order to sell something and, make a better livelihood. That was quite, telling. And that was found through the research. The research team made representation with the government, and now it's possible, I'm told, in Cairo, to go at a single place to get the registration of your enterprise, the advice on your business plan, the support for credit. And, this is not rocket science, but research helped to find a solution to something that was found to be a difficulty with relatively modest investment. Un dernier exemple j'aimerais vous donner.
Example I'd like to give you is once again in terms of agricultural innovation in Ethiopia, which is one of the countries that has the heaviest burdens of malnutrition in the world. And there we have researchers from the University of Saskatchewan and the University of Hawassa who are joining their forces together, and they're developing new varieties of legumes, chickpeas, lentils, and other legumes in Canada, developed over the last 10 or 15 years an internationally recognized expertise. And what happened is that there were researchers in Ethiopia who looked at the conditions they had, the productivity they were getting, and along with Canadian researchers, developed new varieties that are available. We have to produce them. We have to produce enough for sowing. But right now we have reached 600 farmers with this research project, and we know that with one single enterprise which is involved, a small enterprise, in the distribution and production of seeds, we can reach easily 3,000 farmers. That's what we call a bit of scaling up. It's not yet 3 million, but 3,000 is better than nothing. And it is no lot, but it is not sufficient, because this money, this greater agricultural production must be there for everybody. So the team works to have a fair approach for the families, for the groups who are involved in these activities, to see that they benefit from them.
I think that you might have seen from these few examples that IDRC is exercising leadership in development research. And, we use, as I was saying, only a small fraction of the Canadian international assistance envelope, less than 3% of the international assistance envelope. And we use it very carefully, and we use it also in partnership. Last year, we raised about $54 or $59 million of revenue, $53 million of revenue from external funding. Department for Foreign Affairs, Trade Development, Department for International Development, UK, Australian Aid Agency, Hewlett Foundation in the US, the Bill and Melinda Gates Foundation in the US, Netherlands, Norway. Why are we working together? Well, because we think that if we bring our resources together, we can make a greater impact in the field. Is it easy? No, it's challenging. But we are learning. Since 2006, I've participated in a number of partnerships. And now for every dollar that we put in a partnership, we are able to raise $3 from other sources. That's quite important when you think about it. It helps us as Canadians, and it helps in other countries to feel that their money is well used, serve a purpose that is helping people in the field, and that we are not spending it alone. We are together into the journey. Now, I think that you might realize now that I have a passion for this organization. I've been working here for almost 17 years. It's part of my DNA. And it's part of the DNA of all my colleagues that work at IDRC that we have a little soft spot in our heart where we want to make a difference. And I'm sure as citizens over here, you want also to contribute to a change. You are contributing to the change. This is the annual public meeting. You are our stakeholder. We are fully accountable. You can look to our book. You can look to our book. We're not hiding anything. Do we have always successes? No. We have failure. It's research. If we knew what we were going to get as a result, we would not be here. And sometimes this is difficult to explain. Take, for example, the people that we have worked with over the years. Ricardo Lagos, young researcher, became president of Chile. Nelson Mandela, IDRC with CEDA at that time worked towards the transition of an apartheid regime towards democracy, working on reform of institution, election, water management, broad area topic. What happened? First cabinet, half of the researchers were former or recipient of IDRC support. I can do name dropping. The World Food Prize, 2010, 2012, received support from IDRC. And, we have worked with MS Swaminathan, who has been the father of Green Revolution in India. The list can go on. But, if you were asking me, could IDRC have predicted this? Never in 1,000 years. Young researchers that we have been supporting all over the world have made the change in their country. Some became president, others stay just good researchers in their field. But I can tell you with the number of visits I've done in 16 and a half years in the field, every time there is one that has received our funding, he comes to me or to my colleague and says, my first grant was from IDRC. Or, I've been involved with IDRC. I'm thankful to Canada because nobody wanted to support me as a researcher, and you came and you gave me money, and this gave me the opportunity to do this, and that. And you can ask anyone that works at IDRC. We have a ton of story of this kind. And I don't want to trumpet and pedantic, but this is the type of network that we are building. In between the researcher with us, but researcher also with others in Canada. The number of relationships that we have been able to build over the years are so numerous that it's difficult to follow. But I think it's important that we know this. Finally, I talk about the self-reliance, I talk about the impact, the accountability, the networking, the relationship. Well, I haven't talked about the most precious asset in my view of IDRC. It's staff. You'll hear from Federico. The staff of IDRC, and I've worked in the private sector, I've worked in university, and I can tell you, I don't know a place where there is as much passion as in this place. So much passion that we are a Crown Corporation with an alumni association. Not only an alumni association that meets every year and tell their story about 1972 and ask where we are. They are supporting grants for young researchers. This year, they mobilized how much? 3,500, 5,000 on India for supporting a young researcher in Asia to work on sexual violence against women. These are people that have worked here and, that want to stay connected and make a change. Find me an organization like this in the world, it's rare. And it's because the people count over here. People are making the difference. People are passionate, they are accountable, and they love this organization. And my job is to make sure that we are pursuing this journey together. It's a place that is unique in the world. It's a place that you don't have a single idea how fun it is to come every morning and how tough it is to leave at night. My wife is here with my daughter. They can testify about this.
So before I end, I would like to say one simple thing. For me, it has been a pleasure to speak to you for the first time as president. It has been a pleasure to carry on and to work this role and to maintain this quality, this passion, which reflects on the whole of our country, because it's linked up to the policies of the country, not just our foreign policy or our international development policies, but also in the environment, science and technology, industrial development. We contribute to all of that, and we are doing it as best we can. And we hope that we can continue, and we hope that you will be able to tell it to the people around you that the IDRC does quality work and does work that is well anchored in the Canadian reality, but works to creating a better world. And with that, I would like to thank you for your attention, but I could not end off without thanking Mr. Denis Desautels. Denis, in the last 9 months, he has been my mentor and my guide as acting chair of the board, and they asked me to serve the IDRC, and one does not refuse to serve the IDRC. But I do my best, but I am guided by the board, by my own staff. But Denis has been an exceptional mentor, so skilled when he tells me, Jean, calm down a bit, and he'd tell me, no, you can't do that, or he'd say, yes, go ahead, try that. And Denis and I have a common passion, and that's hockey.
It's hockey, and we are, having good conversation on the topic from time to time. And if you're familiar with hockey, you have to go in the corner, you have to grind a little bit, play with the elbows, pump people. Then you do beautiful passes, and then there's a goal that is scored. The Stanley Cup is tough to get. We're Abs fan. It's been a long time since we've been seeing one. But, there's other teams in this country also. Denis, vous avez été plus...
Denis, you have been more than a captain. You have been more like a Director General for the IDRC, if you use the hockey analogy. And so I express my full gratitude and my thanks for the support you have given the organization and the time. None of you here can imagine how much time Denis spent helping the IDRC over the past few months.
Together, but thank you very much for the support, and thank you very much for your patience in my presentation that I think demonstrated the type of work that we're doing here and that we should all be proud. Thank you.
Comme vous le voyez, notre président ne manque pas d'enthousiasme
You can see our president doesn't lack any enthusiasm, and I can tell you that this is enthusiasm is contagious, and that's why we have a team behind Jean that is so motivated. Maintenant,
serving regional director, Federico Burone, an economist by training. Federico joined IDRC in 1997 and has joined our regional office for Latin America and the Caribbean since 2001. He's going to tell you about the role that research and innovation play in the prosperity of that particular region. Federico?
Merci, Denis.
Thank you. Thank you. I'm very happy to be here in Canada and in Ottawa, which I consider as my second home.
Because I have the opportunity to do what I love, Jean, to talk about IDRC's work in Latin America and the Caribbean and to share some inspiring stories from the field. Today, as Denis said, I will talk about the role research and innovation play in the prosperity of the Latin American and Caribbean region, particularly in rural areas. SMEs, small and medium enterprises, are vital to the economy of Latin America and the Caribbean. They account for over 80% of companies and provide 2/3 of employment. However, they are not living up to their potential, particularly in rural areas and for women. As OECD Secretary General Angel Gurria said last year, SMEs in Latin America have the potential to act as catalysts and help the region drive up productivity, greater coordination among different levels of governments, greater coordination among sectors, is needed to help SMEs overcome obstacles in terms of access to financing, human capital, and innovation. IDRC support projects in the region that accomplish exactly that. They help entrepreneurs and SMEs to realize their potential, which is, in turn, improving opportunities for individuals and sectors of the population to bring their products, their ideas, and work to market. So let's look at some examples. As we probably all know, the strong demand from Asia for food, especially protein-rich food, has changed the production, the quality, and commercialization of food in Latin America and the Caribbean, from traditional to commercial crops like soybeans. In this context, it is increasingly important for governments, business, and industry to maintain and improve the production and sale of essential food crops for local populations. These include potatoes, maize, beans, and quinoa. Ensuring market access for quality products that satisfy both nutritional requirements and consumer demands requires intensive analysis to identify, to select varieties, and improve cropping and marketing techniques in the region. This picture shows the result of an IDRC-supported project on potatoes carried out by McGill University, the University of New Brunswick, in partnership with the National University of Colombia, to do exactly that: identify, test quality, and select varieties adapted to the weather conditions in the province of Nariño, one of the most critical provinces for the future agriculture development in Colombia. This is part of the Canadian International Food Security Research Fund that IDRC is implementing in partnership with Foreign Affairs, Trade, and Development. Going to another example, rural areas and populations in Latin America and the Caribbean are increasingly being recognized and included in setting government priorities in the region. The Latin America and Caribbean region has begun to change towards learning more from each other and appreciating its creative potential. In this context, governments, the business sector, and civil society agree on the importance of an environment that is conducive to the creation of new SMEs. They also agree on the need to stimulate the creation of employment in rural areas if economic prosperity, as we heard, and stability is to be achieved. So most Latin American and Caribbean countries have for the last 10 years been implementing social protection programs whereby money is transferred to poor and vulnerable people so they can send children to school or ensure that family members receive health care. The new goal of these programs is to increase the opportunities for progress and to help new beneficiaries access sustainable sources of income. But the ability to save, to think in terms of productive investments, or to start a new enterprise depends largely on access to and understanding of the functioning of the financial system of banks. Because the beneficiaries of these programs don't have the knowledge, IDRC, in collaboration with the Inter-American Development Bank, the Ford Foundation, and the Ministries for Social Development of Chile, Peru, and Colombia, are implementing programs to improve the opportunities for rural women to invest, to understand the functioning of financial systems, to create and make their own decisions regarding the creation of new save accounts. Other countries in the region are now joining IDRC in this hemispheric platform that is supporting research on those issues. Elena, the young woman in the photo, shows her notebook with records of her savings and her investment plans in a new cooperative that will distribute fresh vegetables to new and growing restaurants in Peru. Like Elena, 900,000 people in the last 2 years in Peru have opened bank accounts for the very first time and have started saving programs and have been trained on how to manage micro enterprises. Employees at the banks are also being trained using the research results to understand this emerging market, how to deal with beneficiaries, how to assume this responsibility. The last two examples are in the health sector, and I'm focused on how to move from an experiment to a business, and on the importance of innovation, permanent innovation, to make the new business sustainable. One of the 3 newborns in Peru suffer from jaundice. If left untreated, it can cause permanent neurological problems. Currently, the technology available for treatments in rural areas in most of the Andean countries is handmade and inadequate, and the more expensive options available are in urban hospitals and are difficult to access. A group of engineering students in Cusco, in Peru, who understand the rural life, worked recently with doctors and rural health workers to develop new equipment that uses LED light, uses light electricity, provides the needed treatment, and is inexpensive to buy and maintain. IDRC provides resources to study how this idea came to light. Research on the effectiveness of the technology and its potential market led to financial support from the private sector to this new enterprise. Using the research results, the students who paid attention to a problem affecting their own people received funds to start a new enterprise. In the first year of operation, after receiving the proper clearances from the government, more than 1,200 babies from more than 40 clinics were treated. This is a project that IDRC is implementing testing this type of experiments, understanding how small funds could really catalyze research that could create this type of opportunities, and is done in partnership with the International Fund for Agricultural Development. And there you see another innovation recently presented by this same group of people, this new enterprise company. Because most women in Peru's rural areas carried their babies in a pouch, a neonatal phototherapy kangaroo-type carrier was developed by them. This reduces the duration of treatment compared to the use of regular incubators. The carrier is lightweight and easy to handle and is comfortable for both the mother and the baby. And again, respond to the need and the culture of this particular part of the region. Moving forward, IDRC supported research in the region around elements particularly regarding the future of innovation and the creation of new enterprises will focus on three key areas. First, on how small enterprises can better participate in natural resources value chains, on the creation of new sources of employment, and on how innovation can reduce potential social and environmental impacts. Second, on how we can increase the inclusion of women in the creation of new enterprises and employment, particularly in distant and rural or more rural locations. And third, on how we can best transfer some of these lessons learned in Latin America and the Caribbean about jobs and opportunities for women and youth, particularly to other contexts, such as Africa. Although I could spend, obviously, I would say hours, but I was a bit intimidated, sharing stories about the fascinating work of IDRC in Latin America and the Caribbean. I will end my presentation here, otherwise I will be in trouble. So, merci de votre attention. Je me serai un plaisir.
Thank you for your attention. I will be very happy to answer your questions.
Merci beaucoup, Federico.
Thank you very much, Federico.
As you can see, we try to give you a flavor for what all the good work that IDRC does by covering a sample of projects in various fields in different parts of the world. So we've traveled quite a bit in the last 45 minutes. But now it's time to hear from you. We would welcome any question that you may have, and please feel free to speak in English or French or Spanish, and our microphones, we would prefer that you use microphones and introduce yourself when you pose your question. Donc, si vous avez des questions pour...
If you have any questions, please use the microphones, and do not forget to name yourself and before asking your question. First question.
Norman Looker. I'm a vice president with Co-Water International, a consulting firm here in Ottawa that does work in international development. One of our founding people was Dr. Mike McGarry, who worked at IDRC prior to coming to Co-Water. He continues to work with Co-Water and helps us implement multi-million-dollar drinking water supply and sanitation projects around the world. I have a very basic question. What's happening with your funding, and what do you think is going to happen with your funding?
Well, we're going through the normal processes like every other Crown Corporation or department. You've seen where we've been in the last few years. We had to go through a budget reduction exercise, which has kicked in over a 3-year period, and the coming fiscal year is the third year of this 3-year cycle. So there will be another portion of the main appropriation being reduced. So our appropriation over that period will have come down by about $23 million, I believe. And our total headcount came down by about 75 over that three-year period. So that's what we expect to happen in the coming year. On the other side of the equation, we also are able to negotiate partnerships. So with the parliamentary appropriation, we are able to leverage some of that funding in negotiations with outside partners, so that we, in addition to the parliamentary appropriation, we can get to somewhere in the neighborhood of $60 million in this coming year, or is
79 next year.
And so we are doing quite well in terms of leveraging the parliamentary appropriation to negotiate partnerships with outside providers. So our hope is that when we combine the two, we should be programming about 200, spending in terms of programs about $200 million in the next fiscal year.
Thank you. I have violence prevention in my DNA, like you have IDRC in your DNA. I was very pleased to hear you mention violence prevention in your overall speech.
Excuse me, could you introduce your name?
I'm Irvin Waller. I'm a professor at the University of Ottawa and president of the International Organization of Victim Assistance. I want to reinforce the work that IDRC has been doing in Latin America. I think it's very low on the radar screen, but some of the stories you've told about people who have come to Canada and learned stuff and then gone and applied them in their country is very much what's happening in Mexico at the moment. That because of your work has probably the best violence prevention legislation anywhere in the world, and very good victim legislation. And as you're aware, the new president has made violence reduction his number one priority. I'm sure you're also aware that the World Bank has said if you're going to have successful economic development, then you've got to prevent violence. And unfortunately, the World Bank doesn't really know how to do it. So I think your work is extraordinarily important at this time. And I think there really is an opportunity to build on some of the seeds you've shown in Mexico, not just in Mexico, but for Central America and for the very high violence countries below it. Their levels of violence are off the map by any indicator. And I think you hold some of the keys to bring them down to levels that are tolerable. I don't really have a question, except I hope you're going to keep doing it.
Well, thank you very much. And thanks for the acknowledgement. And as I will repeat it, it's the work of the team of IDRC of experts that put us on this track about looking at violence as a key issue to be taken into consideration if we want to accomplish better development. So thank you very much.
My name is Prabir Nyogi. I'm a visiting fellow at the Canada-India Centre for Excellence in Carleton University, having recently retired after 35 years in the Government of Canada. My question is also a general one, and it has to do with how knowledge and experience and best practice is transferred from one region to another where it may be relevant. Let's take Federico's example, where you said that due to a certain program, 900,000 people, I presume many of them were women, opened bank accounts for the first time in it's Peru? Peru. Now, did you learn from the experience of the Grameen Bank in Bangladesh, for instance? Was it relevant? Or if you look at it the other way around, is that experience translatable to the South Asian condition?
Our colleagues that are the specialists on this particular issue work in a matrix that is ensuring that the knowledge that is produced in the different regions are being used to make decisions and to contribute with the preparation of new proposals. That was definitely one of the insights that was taken into account, preparing our collaboration with institutions in the field, but also our integration in this platform where regional banks and governments are really learning by implementing those programs. How we can do it, how we can transfer now this type of experiments and this type of lessons learned and this type of evidence to other regions is something that we are discussing. Moving a bit to other example in terms of what we are doing with issues regarding new policies that are trying to respond to the key concern around youth and unemployment. IDRC is participating in a couple of weeks from now in an event that we organize in partnership with the government of Brazil, responding to a substantive direct invitation from the government of Brazil to bring to the table real, let's say, innovators that are trying to respond to this growing pressure on how countries should articulate public policies and the effort from the private sector to provide youth, the young generation, with the proper quality and the proper opportunity to reach employment. So it's not, in this particular example, where we are bringing to a discussion a representative from different countries, we are also inviting our colleagues that are working in Africa to learn from discussions in Latin America, where we are trying to, in this case, organize a partnership with one of the most, let's say, influential governments in the region to deal with this particular issue, taking into account that soon, probably Sub-Saharan Africa will deal with, it's already doing, colleagues are organizing a discussion, but I think that we need to optimize resources, ensuring that learning and discussions are really circulating across the regions where we intervene. So we have mechanisms, we are using it, and frankly, probably soon we will do exactly the same on the issue of financial inclusiveness, because the new set of projects that we are launching are focused on measuring the impacts, understanding in which context these policies are working, really providing or creating a substantive difference. So there is an opportunity soon to organize this learning and share it with different institutions and regions where IDRC is present.
We have another question on my right.
Great. Thank you. My name is Robin Bright, and I'm with the Micronutrient Initiative. And the Micronutrient Initiative has the pleasure of having been born out of IDRC. And a general question, but maybe in two parts. Would be interested to hear your reflections on how IDRC arrives at or develops its research focus areas and priorities. And for organizations that have a similar heart and mandate of wanting to develop both science and operational research to guide international development, how we can be thinking about working with the IDRC to map the research agendas to be able to be complementary in our work. So I'd love to hear reflections on that.
Yep. Jean?
Yes, thank you, Mrs. Wright, for your question. On the research priority, we have a strategic plan that we are developing every 5 years. It's our quinquennial plan, like in the former Soviet Union. There's no similarity there, but it works. It's 5 years and it works. What we are doing is essentially taking a multifaceted approach. First, we have to acknowledge and recognize that our Board of Governors is providing us with guidance that is built around the knowledge that is present on the board, but also feed by management through an extensive consultative process. We have consultation in each of the region periodically with expert, recipient, former recipient, non-recipient that provide us advice and guidance. So where are the priority, or where should be the priority, and how we can do a better job. We are also running consultation periodically with Canadian stakeholders. Canadian stakeholder involved, what we call the official Ottawa government actor from various departments, as well as with our minister. involve also the civil society organization, and involves the academic more and more, as there is strong ties that are developing between Canadian University and IDRC. It has always been present, but there's some programming that they've given greater importance to the collaboration between Canadian researcher and the Southern researcher, and I think that's good. We are still doing a large amount of business directly in the developing region of the world. We have always done business with Canadian partnership. We have been doing programming now involving Canadian actors, but always with the same spirit. The money is spent in developing region of the world for problem of developing region of the world. That brings the expertise. Lastly, there's a new actor that has been coming to IDRC. In fact, it's not that new, but there's a new emphasis with the involvement of the private sector, where, I think there's a lot of people that are talking about it. There's very limited. There's certain knowledge of what can work, what cannot work, but there's certainly a desire to understand it better. And we have these type of conversation internally, externally. 2 years ago, we held the first conference on public-private partnership in agricultural development, research development. Here in this room, 120 experts from around the world. We're going to have another one with the support of Syngenta Foundation for Sustainable Agriculture in the spring. So that's the consultative process. And lastly, our staff that we are also involving into this. So that gives a strategic plan on why we are in certain area. Currently, agriculture, environment, social economic policy, global health policy, science and innovation. How to connect and map what we're doing? Very good question. Numbers of tools are available. First of all, our staff, our director, our program officer. Second, our website, which contains, very thorough information. Second, our digitalized library. The IDRC Digital Library, the IDL, is an open source of information, free and available to anyone that wants to go and dig into it. It contains, scientific publication. It contains report. It contains book. And then there is research association or research group or research network that are active. Consultative Group on International Agricultural Research, for example, the African Economic Research Council in another field. These are all networks that IDRC has helped to create or is participating into, or where our partners are meeting. And this is a venue where, people in the field, like in the micronutrient, can connect and see what is the landscape of the world generally in the field, but can also zoom towards what is more specifically IDRC doing.
Yeah, you're next.
Thank you very much for hosting this event. My name is David Pisnimimo from the Genotech. We're a biotech company out in Canada, and we specialize in genomic research. I just recently returned from conferences in South Africa on malaria and Washington, D.C. in neglected tropical diseases. And I noticed a huge involvement by the British government, by the Australian, by the American USAID, but quite small presence of Canadian involvement. In relation to the question of previous speaker, what is the priority list of TB, malaria, neglected tropical diseases on IDRC research scheme? And since Denis Genotech is a private company, part of my responsibility is to look for partnership in the private and public sector. And if you can comment on that, that'd be great too. Thank you so much.
Yeah. Thank you. Very good question. At the high level, I will repeat, the website is a prime place, and then, the telephone call. You happen to be standing right next to our Vice President of Programs, Stephen McGurk. That is also a good source of information. Specifically, on the topic that you are mentioning, IDRC has been active into the linkages between the environmental condition, animals, and human health through a program that is called Ecosystem and Human Health that is led by Dominique Charon. I don't think she's here tonight. This program has been created some, 16 years ago, as many
successes in terms of research, many challenges in terms of sometimes big failure, but overall created a network of researchers around the world, that are calling themselves eco-health researcher. There's a peer-reviewed journal that has been created. There's a vibrant community conferences. And specifically, IDRC in the last years has been involved in emerging and re-emerging diseases. Prior to the SARS, or just around the SARS episode, saying that, there's about a 30% burden of disease that is directly related to environmental condition in the world. Diarrheic disease, diarrheal disease, malaria, vector-borne diseases. But there's an important segment of a black box that is called the emerging and re-emerging disease. And every time there is one beast that get out of the black box, you have the media, you have the world that get excited and worried that the entire planet's going to be disappearing. Is it right or is it wrong? We don't know this. It could be right. One day it might be right. Up to now it has been often wrong. But even if it was wrong, it adds serious impact. Take, for example, SARS episode or H1N1 avian influenza episode in Vietnam, culling of the entire poultry in the country. You know very well what can be the impact on a family if they have chicken in their backyard and, by a government order, in order to control the spread of disease, you kill all the chicken. That means something to the people. Is it effective? We didn't know that. In fact, some of the research we have sponsored has shown that it's not that effective in order to control the disease. So we have a network that works in this area. And the most recent avian influenza episode that took place last year, Stephen, or 2 years ago, in Asia, guess who the government called? The network that we have helped to support that is active in China, Cambodia, Vietnam, Indonesia, and Thailand. And these people, are researchers. But for the first time, they are working together because these diseases don't know boundaries. And not only are they working together, they are sharing information. And in the context of the region, it's a first. I think it's quite exciting. So if you are interested in that field, please have a little chat with Stephen. Look at our website under EcoHealth, and there is certainly very interesting thing that you can find.
Okay, I think we'll take one last question, if you don't mind.
C'est juste un commentaire.
Oui.
This is just a comment. I would like to congratulate Jean, whom I met in Argentina, thanks to Federico. I teach at the University of Quebec in Montreal in communications and development. And to answer the colleague who talked about that bank, and this is the importance of research, and I commend Federico for all the work he's done in Latin America and the Caribbean. I was involved in a project becoming a protagonist. Why? And this was closed. In Uruguay, there are jobs, but there are other factors such as violence, which are really of concern. And there, it's not a question of employment, but these other factors are highly important. I would also like to, I've known IDRC for the last 20 years. They have ADN, and he's missing football in soccer in Montevideo today to be here this evening. Well, thank you, Carmen, for these words. Federico is our representative in Latin America. I would like to recognize the 3 other directors who come once per year during the Board of Governors in India. Chatterjee, our New Delhi representative, Simon Carter at the Nairobi office, who deals with sub-Saharan Africa, and Bruce Rihelder, who leads our office in Cairo and who works in North Africa and the Near East and Federico in Latin America and Central America. So I thank my colleagues. We'll accept a last question. Thank you. And then we will be here. If you would like to come and ask us questions, do not hesitate in a more informal way. Rachid, I'm here as a simple citizen. I'm interested in international development. And my question stems from what I see. There are about 1 billion handicapped people and 750 million can work. And these people have working conditions that don't offer them much opportunity. Either they're unemployed or the working conditions that are offered to these handicapped people, as the International Organization of Work says, it costs between 1 and 7 points of gross revenue for these countries. And at the same time, we find several organizations, the United Nations. There was a conference organized in New York. The General Secretary launched an international call to include handicapped people in general development projects. At the same time, in the West, we've seen several specific policies over the last 30 years, and the experience shows that these policies don't give the results expected. We want to include the handicapped aspect in general projects rather than in specific projects. My question to you, Mr. Lebel, what are your intentions to reinforce the place of those who are handicapped in your projects that are supported by IDRC, so that the handicap becomes a factor of development in the world and in the countries that you work in throughout the world? Thank you, Mr. Rachid, for your question. You're asking a question. I have not thought about this, but I will try to give you an answer. There are 3 aspects to this. First, I can mention that IDRC, as an organization, as a Canadian organization, sees to it that the presence of those with handicaps is entirely aligned with the policies with human rights, and it's not a problem. However, you're talking about what happens in other countries, and very sincerely, I don't know the situation completely. I don't think we're undertaking research on these questions unless it's through our program on global health, but I do not believe so. And your question is an excellent one, and I'm very honest in saying I don't think we are looking at these aspects, and there are other things that we're not working on, but you did bring this to my attention. I'm going to check this out. And from what you've mentioned, there's another problem which arises, which is not the physical handicap, but the mental one. And in the world of development, it's a problem which is highly important, and where we see there's a research team on global health that is working on the mental health aspects, but with the Canadian government and the Canadian Institutes of Health, and with an organization in Toronto, Grand Challenges Canada. There's a health research consortium in health and in innovation where there's a specific program on mental health, which is doing pioneer work at the international level. And this is a very partial answer I'm giving you, but thank you very much for your question. It was an excellent one. Thank you, Jean,
for your participation here tonight and for your questions. This is the end of the formal part of our program, so I want to really thank you sincerely for joining us today. Feel free to stay around for a little while for light refreshments and a chance to chat informally with some of our people, some of our governors who are still here. So, merci à tous. Je vous souhaite donc.
Thank you to all. I hope you enjoy the rest of the day.